Hello, I'm Dr. Frances Pitsillis. Why should you be worried about snoring? Well, there's snoring that's annoying, but snoring that's dangerous. The everyday garden type of snoring can still be quite bad. It can go from separate beds to separate rooms to even separate houses. The problem with that is usually overweight and lax muscles around the neck and throat, and the underlying causes also can include blocked sinuses and noses. But this problem tends to get worse with age and affects men and women. If you ask couples these days, many of them will say that they each snore. Snoring is defined as breathing during sleep with a hoarse or harsh sound that causes the vibration of the soft palate, which is at the back of the throat. And I've already mentioned the problems, but what can you do to reduce snoring? Well, look at fatigue and stress, lose weight, look at your alcohol consumption, sleep on your side rather than your back, and avoid smoking because it causes congestion of your nasal tissues. When should we worry about snoring? Well, that's when you witness your bed partner to stop breathing. That's when you should worry, because stopping breathing is getting ready to die, isn't it? And what then happens after a period of no breathing at all, is that you then witness your partner sort of gurgling and splurting away because they're waking themselves up from a near-death experience, so to speak. So you should worry about that because that puts extra strain on the heart and increases the risk of sudden death and heart failure. With this condition, it is more common than asthma in New Zealand, with a preponderance rate of 10% of middle-aged men. The same causes for obstructive sleep apnea are present as for normal snoring, except the problem is that the person is not getting enough oxygen, they're not getting a decent sleep, they wake up tired, they fall asleep at the wheel, they fall asleep in the doctor's waiting room, and they're not productive and they don't function very well at all. Now, I've already mentioned how to spot the symptoms of someone with obstructive sleep apnea. They're asleep in the doctor's waiting room. But if you're the sufferer, you feel that you're not functioning well, you get a headache, and you can have erectile dysfunction, and you can have even bedwetting and acid reflux. If you're the wife or partner of someone with obstructive sleep apnea, you will notice not just the snoring, but the mood changes, the erectile dysfunction, and the grumpiness. So it's very important that this condition is identified, usually by the bed partner, and acted on. Now, there's more of a preponderance of this condition in people with an underactive thyroid, too much growth hormone that causes acromegaly. This is very uncommon, but the person gets very big features. And a condition which is rare called Ehlers-Danlos syndrome. And this is a disorder of connective tissue. These people usually have very lax ligaments in their hands. The full effects of sleep apnea syndrome can cause relationship problems apart from health and daytime sleepiness, hypertension, abnormal heart rhythms, chronic daily headache, poor memory, depression and irritability, acid reflux, heavy night sweats, raspy throat, and general fatigue. So how do doctors deal with this? They take a good sleep history, often with the partner, and these days the partner will bring a recording of the snoring and the stopping breathing. There's a good examination, and one of the things to check for is the circumference of the neck in a man, anything over 48 centimetres. The specialist in ear, nose and throat will check airways, nose, sinuses and palate. and see if there's problems with these or the gums and the teeth. And how big are your tonsils and how far can you get your jaw open? There will be more tests to look at your biochemistry, hormones and metabolism, and then most likely a sleep study where all of your functions are recorded while you're sleeping, including muscles, brain and breathing detection devices and oxygen meters and a leg movement detector, as well as a microphone. Now, when all of that's been done and it's been diagnosed that you've got obstructive sleep apnea, then you've got to look at the treatment. Once again, losing weight, stopping snoring, correcting any biochemical or metabolic abnormalities is going to be helpful. Looking at what the jaw is doing and dental devices. And everyone's heard about the CPAP machine. That's the continuous positive airway pressure machine. Now, they're getting a lot better. They're not as noisy and they're not as uncomfortable. And people who wear these devices absolutely say that their life has been restored. Now, last and sort of not high on our list, but obviously when you really have to go there, there's surgery in relation to the palate and the areas of the nose and throat that might need help to reduce the snoring. So, although you don't think about snoring very much as something to consider as a health hazard, there needs to be more awareness of this and not just laughter and giggling about someone snoring, that you really should ask a few more questions and encourage people to perhaps get things assessed if they're snoring or particularly severely snoring and stopping breathing. Snoring is really a serious health hazard.